Hi, thank you for attending this brief education session on free HIV testing here at UNLV. My name is Russell Arginal. I'm a wellness educator for the UNLV Wellness Zone, and I'm just gonna take about 10 minutes of your time to talk about the free HIV testing program that we have through the Student Health Center. It's gonna be from December 15th, 2020 until February 19th, 2021. We have a limited amount of tests to give out, so hopefully you learn a lot from this presentation, and then we can get you ready to get tested for HIV, if that's what you want to do, which is why you're watching this session. So what is this presentation about? We're going to cover the basics of HIV, HIV testing, harm reduction techniques, and then how to get tested at UNLV. And remember, this presentation, you can stop at any time if I'm going too fast. That's the great thing about it being virtual. You can do it all on your own free time, at your own speed. So who am I again? My name is Russell Arginal. I'm the wellness educator for student wellness in the Department of Wellness Promotion at the UNLV Wellness Zone, the long title. But also I am a certified HIV tester and counselor through the Southern Nevada Health District, the rapid testing program. So I am certified in being an HIV counselor. So at the end of the presentation, I am going to give you my contact information. So if you do have questions regarding personal risk and other issues related to this topic, you can contact me and we can have a one-on-one discussion if that's what you want to do. So what is HIV? HIV stands for human immunodeficiency virus. So basically HIV is a virus that attacks the immune system. It specifically attacks our CD4 T cells. These are our immune system cells, right? These are important for fighting off infections and strengthening our immune response. So over time, without treatment, if HIV is left untreated, it can severely weaken the immune system, making it harder to fight off diseases. There is a difference between HIV and AIDS. A lot of people tend to use them in the same context, and they're not the same thing. AIDS stands for acquired immunodeficiency syndrome. So an HIV infection can lead to AIDS, but they're not the same thing. AIDS occurs when enough CD4 cells have been destroyed. The immune system is severely damaged, making an individual susceptible to opportunistic infections. And I think so, like the CDC defines AIDS as someone who has 200 cells, 200 CD4 cells in a cubic milliliter of blood, 200 or less. Usually people have about 500 to 1400 CD4 cells in a cubic milliliter of blood. So that's usually how they define AIDS. HIV can be transmitted through sexual contact, injection drug use, so sharing needles, and through mother-to-child transmission. Those are the three most common ways HIV is transmitted. It can be found in 6 fluids, which are blood, semen, preseminal fluids, vaginal fluids, anal mucus, and breast milk. So basically one of these fluids has to enter the bloodstream or have contact with the damaged tissue or mucous membrane. And when someone has like STIs or other open sores or wounds in their body, it increases the risk of someone getting HIV. So in that red box, those are the 6 ways HIV can be transmitted. Again, it's blood, semen, preseminal fluids, vaginal fluids, and the anal mucus, and breast milk. If it's not one of these fluids, HIV cannot be transmitted to somebody. So in that blue circle to the right, well, at least to me, it's to the right, might be to the left for you. I'm not sure how this works with PowerPoint, this is a figure from the CDC, and it's basically ways HIV is not transmitted. You know, you cannot get HIV from saliva, tears, sweat, shaking somebody's hand, hugging somebody, through the air, through a mosquito, sharing a toilet seat. Like there's a lot of misconceptions with how HIV is transmitted, and there's a lot of stigma associated with it. But you know, we can fight that by just educating, by being educated, and remember the 6 fluids which contain HIV are in that red box. And how can someone tell if they have HIV? Well, it's to get tested. That's the main way, because some people experience no symptoms. That's actually the most common symptom of STIs, is having no symptoms. That's why you need to get tested for HIV and all STIs, right? Whether it's like gonorrhea, chlamydia, syphilis, and so forth. Many people don't experience symptoms, so you need to get tested, because long-term effects of living with an STI can lead to like some serious health issues. So you should get tested. Some people, if they're infected with HIV, experience flu-like symptoms within the first 2 to 4 weeks of being infected. And people who are newly infected are the most infectious. Additionally, many HIV antibody tests cannot detect the virus until 3 to 6 months after someone is infected. Which is going to bring us to the window period. So the window period is the time frame between infection to seroconversion, or when antibodies of the HIV start appearing in the blood. So if a person is still in this window period, the HIV infection may not appear on the test. So for the test that we are providing at UNLV, we recommend to wait at least 2 weeks to 3 months after an exposure to get tested. This gives it enough time for, if someone is infected, for antibodies to start showing up so that the test can detect it. However, most people are always going to be in this window period, especially if someone is sexually active. So we recommend that everyone get tested every 3 months. Some ways to reduce the risk of acquiring HIV are through using condoms, PrEP and PEP. This is a brief education session, so if you want to know more information about PrEP and PEP, these are great prevention medications, and you know, you can schedule an appointment with me and we could talk more about it, or you can Google it and just start knowing more information about that, or speak with a provider as well. Try low risk sexual activities, right? So things like oral, anything that's not like insertive sex can reduce the risk of acquiring HIV. And excuse me, I like penetration sex, I mean. Injection drug use. So if you're gonna be engaging in this, never share a needle, always use clean needles. Communicate with your partner or partners. I mean, remember, the more partners you have, the more it increases the risk of acquiring HIV, so just keep that in mind, but also open communication is always the best. And again, get tested. That's it's a great way to just know your status and as well as your partners to know their status as well. So if something does happen, you can act accordingly. Living with HIV. So there is no cure for HIV. However, with modern medication and treatment, someone living with HIV can live a normal, healthy life. There's a typo. U equals U. So you might be hearing this a lot. U equals U means undetectable equals untransmittable. So what that means is someone living with undetectable levels of HIV in their system will not be able to pass the HIV virus to others. This is with the assumption that someone is taking their HIV meds and they are in fact an undetectable level. And this is when someone works with their provider to make sure that they are managing the proper medication and on a routine so that someone can get their HIV under control. Living with HIV is not a death sentence. Many people are living with it and living healthy lives. So it's good to get tested so that you know, if someone has an HIV infection and they don't know, that people can get on the appropriate medications so that they can you know, get those levels under control. So the next steps, right? So you might be watching this presentation because you were interested in getting tested at UNLV in our Student Health Center. So what you're going to do is, number one, call the Student Health Center to schedule an appointment. And you should refer to the Student Health Center website to see the revised hours, and you must be a UNLV student. Because right now with the social distancing guidelines and the restrictions because of COVID policies, you cannot walk into the Student Health Center. You have to call first and schedule an appointment. Then number 2, take a screenshot of the next slide for your free HIV testing voucher. So I'm gonna, once I click to the next screen, or you can fast forward this video, there is a picture of the UNLV free testing voucher. So just take a screenshot so that when you do go get tested, you can show them that you did watch this video. We just wanna make sure that everyone gets a little bit of HIV education before they get tested. You might be getting tested all the time, so you already know this information, but this is just a reminder, and it's just a good way to just keep informed. After you take a screenshot and you schedule an appointment, then you just go get tested. And you will get your results the same day. It usually takes 20 minutes. And we are making sure that we are following all social distancing guidelines and proper hygiene, and making sure that exposure to COVID is also reduced. So you will have to wait at the Student Health Center to get your results, but we are taking the proper precautions to make sure that you are safe in there as well. And we just want to let you know that we have support services ready. Despite the result, whatever the result may be, just know that UNLV has the support system ready for you, and we will help navigate what the next steps will be, whether the result, how the result affects you. So this is the HIV Clinic Testing Voucher for your free test. So just pause the screen and take a screenshot. I'm gonna smile. Okay. And then finally, if you have any questions or concerns, know that your lab technician or any provider that is giving you the free test will be able to answer your questions. We'll be able to answer all questions you have the day of. Apologies for all the typos in this PowerPoint, excuse me. But if you are getting tested, your provider or whoever's performing the test will be able to answer all the questions you have related to risk and about the test, just to make sure that you are well informed before you leave the health center. Also, I just wanted to reiterate that I am a HIV counselor. And if you want to talk to somebody before getting tested, please email me to schedule a one-on-one virtual appointment if you feel comfortable. That is my email down below. It's russell.arginal@unlv.edu. And I'm more than happy to talk to you about any personal risks that you might have, or if you just want more information regarding what was covered in this presentation. And I also just want to let you know that we have a lot of support services in the community. So if UNLV may not be accessible to you at the moment, please look at free testing sites in Las Vegas or in Clark County, because we do have a lot of free testing resources available. So yeah, thank you again for watching this presentation. I hope that was helpful in some sense, and we look forward to seeing you at the Student Health Center.